Very important to know about the symptoms of ovarian cancer because they are not specific and often they're diagnosed very late. So it may be just an increase in the waist size. You may have a sudden change in your bowel or bladder habits. You may have a sudden loss in weight without trying. If these symptoms are persistent for more than a few days or weeks, you should see your general practitioner and make sure that it's not because of ovarian cancer. The most common age to develop ovarian cancer would be from late 50s into the 60s. So the more advanced the age, higher is your chance of having ovarian cancer. The risk factors for developing an ovarian cancer is a strong family history. There are some genes you might have heard about, BRCA1 and BRCA2 or the BRCA1 and 2 genes, which are high risks for developing breast cancer. But it is also a risk factor for developing ovarian cancer. So along with all these genetic causes, an increase in body weight, an early age of starting your periods, a late age of finishing your periods are all high risk factors for developing ovarian cancer. Ovarian cancer risk reduction would mean leading a healthy lifestyle, keeping your weight optimal, having an active lifestyle, and also making sure that if there is a strong family history, that you see your healthcare professional for regular monitoring. If you develop any of the symptoms that we discussed before, it's important to get the appropriate investigations in the form of further scans and confirm the presence of ovarian cancer and get the appropriate treatment as well. If there is a strong risk factor, we could start with removal of the ovaries even before the start of cancer process. Once diagnosed with cancer, if it's very early, it can be treated with surgery alone in the form of keyhole or open surgery. More advanced cancer treatment is also available in the form of special drugs called cancer chemotherapy or using radiotherapy depending on the type of cancer. But it's important to say, whatever the stage of disease that the cancer is diagnosed, there are very effective scientific and support measures to make sure that you have the best outcome.